Empathy is one of the most challenging components of a therapeutic relationship for novice nurses to grasp and apply appropriately in clinical situations. Yet, it is part of our standards of practice. The purpose of this video is to review what empathy is, why it is important, and how it is demonstrated in an effort to help you express it. According to the College of Nurses of Ontario, empathy involves communicating that as the nurse, you have some understanding of the client's experience. Beyond a simple understanding, empathy involves recognizing and normalizing the emotional experience of the client. Expressing empathy will help the client feel validated and open the door to a truly therapeutic relationship. As a nurse, it is also important not to cross professional boundaries when trying to be empathetic. Empathy must be used with the intention of helping the client. Nurses need to connect with clients while maintaining their ability to remain objective in care delivery. We cannot become inappropriately emotionally attached to a client. I'm not saying that we shouldn't care. In fact, we are expected to care. We just need to ensure that we respond to clients professionally. Maintaining professional boundaries is also an important part of our standards of practice. Expressing empathy professionally is meeting the client's basic need to be understood. There are many benefits to being empathetic. For example, it facilitates trust and helps the client feel comfortable talking with the nurse. This comfort means that clients will be more receptive to any teaching or interventions you discuss. It also helps them accept their feelings as normal, allowing them to work through them. Reflecting on their feelings helps clients develop an understanding and awareness of themselves, which promotes coping. The list of benefits for the client is endless. Being empathetic also helps nurses. By connecting with the client, you are able to react to client apprehensions in the selection of interventions and collect the information you need to promote adherence to the care plan. Being effective in your communication promotes your confidence and job satisfaction. You will also be able to enhance workplace satisfaction by expressing empathy for your coworkers. The ability to become empathetic comes with time, practice, and maturity. As novices, there are a number of things that can interfere with your ability to portray empathy. Reflect on and avoid anything that may interfere with your ability to be empathetic. Before engaging in an interaction with the client, clear your head of distractions and consciously tell yourself to focus on the client. Empathy is a complex skill to master. When expressing empathy, you need to be able to identify how the client is feeling through interpreting their verbal and nonverbal cues. Think about what is the most important message that the client is trying to express. Then, you need to use your own words to carefully label the themes you have identified in a caring way. It is important that your nonverbal messages also convey empathy through warmth and genuineness. To be empathetic, you need to genuinely care about the client. If your caring verbal messages do not match your uncaring nonverbal messages, the client will be left feeling that you do not care. It is also important that you are not overly warm to the point where it becomes non-therapeutic. Be careful that your intended empathy does not get interpreted as sympathy or pity for the client. To avoid being perceived as sympathetic instead of empathetic, focus on the client's feelings. Some authors would suggest, however, that there are times when it can be therapeutic to express sympathy. As with most things in the therapeutic relationship, the nurse needs to focus on what would benefit the patient within the unique context of the situation. In essence, clients need to have their feelings understood. To be empathetic, you need to console the client without attempting to fix their situation for them. Do not make judgments about the client's situation. Avoid using the phrase "I understand," as it can limit the client's perceived need to tell you important contextual information. You want to communicate understanding without telling the person to stop telling you about their situation. Instead, acknowledge and validate their feelings. Be specific and accurate when labeling their feelings. Try to get them to tell you more by using a more open-ended approach. Empathy is appropriate to use in situations where clients are experiencing some kind of emotional pain. There are many ways to implement it. To know when to apply it, you need to be in the moment with the client. Use your professional judgment to identify the best way to respond empathetically. Keep in mind that your goal is to help the patient, and you will be able to sense when empathy is needed. Evaluate if your attempt at empathy was effective by watching for cues from the client that tell you that you have been successful. They may say something, or you may notice them relax, nod, or open up more. Thank you for watching this video. Let me know how it has helped you and what else you would like to see by commenting below. Don't forget to subscribe to receive updates about new videos and posts.